Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
The Royal London Hospital recruited 50 international doctors, most of them refugees, to work in its intensive care department at the height of the second wave of the COVID pandemic. It's part of an NHS England scheme that's helping foreign medical graduates register to work as doctors here. Sadia Chowdhury reports.
He had to be top of the class in Syria just to have a chance to study medicine. But even the strongest can't stomach the horrors of war. Mohammed Saud is a doctor and he's a refugee. And at the height of the second COVID wave, he worked in the intensive care department at one of London's busiest hospitals.
It was really overwhelming working here, and see a lot of people around you, suffering.
Mohammed is part of an NHS England scheme that helps international medical graduates living here in the UK register and work as doctors. The NHS says it's an efficient way to hire doctors fast.
We'll just have a look at your nails.
Ahlam is from Yemen, and when the war started there in 2014, the profession she worked so hard for drifted away.
Just like for me, like even talking to my colleagues, is this the end of the journey as a doctor? Once you finish, you graduate from the School of Medicine, all your ambitions, you can't achieve anything. So is this the end of the journey or are we beginning?
At the height of the second wave, Royal London's specialist COVID unit cared for 160 patients at a time. It was Europe's biggest intensive care department. And tasked with organising the medical staff was Dr. Heike Bohar.
From the time you decide you need new specialist doctors, it takes a minimum of 10, sometimes 15 years to really train them. These doctors come already trained in terms of monetary value. That's very cheap.
There are thought to be over 1,000 refugees on this scheme, and every day they help fill a shortage in NHS staff across the country, doing things like cancer screenings and ultrasounds, and assisting in clearing a backlog caused by the pandemic.
There's a shortage of more than 1,000 consultant radiologists, and Mohammed was fully trained in Syria. He saves the NHS money by not having to train him, and he benefits the patients here because we have a shortage of doctors.
Brings diversity, which can only strengthen any team, particularly in healthcare.
Hundreds of medical support workers have already been employed or are in the pipeline for getting jobs. Doctors here say the scheme is as much humanitarian as it is medical. Sadia Chowdhury, Sky News, at the Royal London Hospital in London.